Well, as the nation prepares for a new approach to the coronavirus crisis, we've been discussing some of the healthcare changes that are likely going to happen in the next few months.
That's right. In a segment called Doctor to Doctor or Doc to Doc, Chief Medical Correspondent Dr. Jon LaPook and our medical contributor, Dr. Celine Gounder, discuss how people are trying to recover from drug addiction and may also face a steeper hill, while Americans on Medicaid may soon find themselves without insurance.
As we've been covering in depth this week, on Thursday, May 11th, the Biden administration plans to end the national emergency and public health emergency declarations related to the COVID-19 pandemic. Now, we've already discussed how this could affect the way COVID-19 is tested and treated.
But the end of the COVID public health emergency will have other impacts that you may not already be aware of, like what will it mean for people trying to recover from drug addiction and the millions who might lose Medicaid coverage.
We'll start with the expected changes to drug addiction recovery, which could be greatly challenged by a new DEA policy in the works and could restrict access to the drug buprenorphine. Now, this is significant when you consider that 40% of counties in the United States, 40%, do not have any buprenorphine prescribers.
That means many patients looking to start recovery may not be able to, and those trying to continue their treatment may have to find new ways to access the drug. If this DEA policy becomes a reality, it could drive an increase in opioid overdose deaths. The unwinding of Medicaid will also affect millions of Americans. As of March, 1 in 3 people in the U.S. were on Medicaid. During the public health emergency, states were prohibited from disenrolling anyone. But with the emergency ending, state governments can start to drop people from the Medicaid rolls again. And as you can see from the map, some are moving more quickly than others.
When all is said and done, an estimated 17 million Americans, that's 5 million children and 12 million adults, could lose their Medicaid coverage. Some will lose it because they're no longer eligible. Others might be eligible but could face administrative barriers to renewal. This, of course, begs the question, who will end up being eligible? If you're in a Medicaid expansion state, you will still be eligible for Medicaid if you make up to $20,120 as an individual or $41,400 for a family of 4. This is up to 138% of the federal poverty level. But if you live in a state that has not expanded Medicaid, the max income to qualify for Medicaid could be a lot lower.
In some states, people have to be really poor to qualify for Medicaid. So with all of these changes happening right now, Jon, is there anything in particular that stands out to you or that you're especially worried about?
Well, I think, yet again, we're seeing that the safety net for people who are underinsured, who are poor, who have no insurance, is being weakened. And I look at this whole pandemic really as a stress test that our public health system, unfortunately, has failed or has done very poorly on. What are you thinking?
Yeah, and unfortunately, I don't think we've fully learned those lessons. So we're coming out of it, as you said, weaker. One of the things that's going to also stop is some of the reporting of test results to the CDC. So hospitals may not have to report those test results as frequently. Some of the information about who's getting COVID we may not have anymore. And so I think it's going to make it that much harder to really figure out what's happening on the ground and where we might need to be paying attention with more resources.
Yeah, we did well on so many areas like creating the vaccine so quickly in less than a year and finally ramping up on testing. It took us a while. We got off to a slow start on that. But in terms of communication with the public, in terms of our underlying public health infrastructure. I mean, we've been underinvesting in public health for decades, and now it's like you said, okay, we're not going to invest in the military, and then a war comes up, and hey, how come you're not ready?
Right, and then we just defund everything in between, which we're already seeing. Some of the money didn't make it down to the ground, and Congress wants to take it back before we can do anything to strengthen the public health system. So,
yeah. My biggest fear is that we're going to say, okay, pandemic's over, on to business as usual, and every expert I've spoken to has said, is there going to be another pandemic? Yeah, it's just a matter of when, not whether there will be one. Are we going to be ready for it?
I don't think we will, unfortunately.
Well, hopefully we'll learn a little bit and inch by inch get a little bit better. And it's lovely yet again to talk to you, Doc.
To Doc.